Hi, I'm Jane. I'm going to be helping you learn about your glucometer today. Um, have you taken any medication that could impair you or sedate you or make it difficult for you to remember? No? Okay. Um, is English your preferred language? Yes? Okay, great. Would you like to sit down and become more, or get more comfortable so you can relax a little? Okay, great. Here you go. You can sit right here. Have you ever used a glucometer before? A couple times? Were you shown how to use it? No? Okay. All right. Today I'm going to be giving you an instruction, and then you're going to teach me back what I taught you and demonstrate how we're going to use the glucometer. The glucometer is going to test the amount of sugar in your blood, and that's going to help you manage your diabetes better. When you have your diabetes managed properly, you're not going to have post-surgical complications, and you have less of a chance for complications during surgery as well. So it's really important to stay on top of it. Normally the glucometer comes in a little case like this. I'm sure if you have one at home, it has a few different things in it. It's going to have your glucose test strips, your lancet device, which you're going to load your lancets into, the actual monitor, some lancets, and alcohol swabs. I'm first going to show you how to use it, and then I'm going to give you a pamphlet and some resources so you can refer to it later on if you have any questions. So what you're going to do is you're going to, after you eat your meal or first thing in the morning, depending on how we're having you monitor your chart, which is right here. You're going to turn your meter on. You can set it aside. You're going to get your alcohol swab ready. What I like to do is tear a little tiny piece off and set it on the corner of a table so we don't contaminate it. You're going to take your lancet device. These look familiar for you. It's pretty easy. You take your lancet and you just put it right in here until you hear a click. And then you carefully take the top off. There is a little tiny needle, as you know. And then we're going to put back the top on. You set it to what depth you want it to penetrate your skin. Can I see your hands? Yeah, you don't look like you have too many calluses, so you don't need to do it too deep. Maybe just 4 millimeters. So you set it to 4. Set it aside. Take your test strips. Make sure you have it in correctly because there's 2 sides. And once you put the test strip in, it's probably going to beep. So you have it ready, and you can see that it's showing a little tiny drop of blood. That's when you take your alcohol swab. You're going to swab your finger. Even though you washed your hands before, you're going to still swab your finger and let it dry. You're going to take your lancet and you're going to prick your finger. Once you prick your finger, don't put your finger where the blood is. Squeeze your finger just so there's 1 drop, and you're going to put it right up to the device for 5 seconds. It will count in front of you. And then as soon as it's done, wipe your finger off. You might need a Band-Aid, and make sure you dispose of the lancet since it is already used. Take that. If you have a sharps container, that would be appropriate to put it in there. You can put everything back. Now, once we have our blood sugar, we need to take a look at it. So mine's 110. We're going to take our pencil, our pen, and we're going to write the date, what day it is, and then we're going to write the milligrams per deciliter right here. So mine's 110. I'm going to write 110 for my morning reading. You're gonna do this 3 more times throughout the day. There's another area on the pamphlet where you can write any notes, anything unusual maybe you ate, any symptoms that you have, and if you exercise. There is a guide for how high or low your blood sugar should be and when to take it. StanfordHealth.com also offers an instructional, and I will give you the website, but it reiterates everything that we just went through. So if you forget what I told you, you can easily look it up on the site, or you can call our office at any time. Now it's your turn to show me what you learned. Okay. So you washed your hands, all right? And you have everything out. Yep, that goes there. Good job. All right. That's correct. Wonderful. Okay, and then just record your response. Do you have any questions? You did everything correctly. So I can tell that you're somewhat familiar with this process. It's very important to keep our blood sugar in check before surgery. That's why I'm explaining this to you. So I want you to monitor your blood sugar right when you wake up in the morning and then 2 hours after you eat each meal. If your blood sugar is running really high, you can call the doctor's office, or if you have any unusual symptoms. Right before surgery, we'll give you prophylactic insulin just in case your blood sugar does rise up, so that we have you covered during surgery. Here's your instructional pamphlet with your log, your diary, that you can take home with you. The website is in there, and you can always call our office, like I said. You did a great job today. I am 100% convinced that you have this down pat, and you will be able to monitor your sugar at home without any issues. Do you have any questions? Okay, great. So the wins, I think, for this teaching plan is the assessment for learning. I think that's really important to begin with, because there are a lot of patients that come in with language barriers or even literacy issues. And then a lot of patients as well have prescriptions for pain medications that are pretty strong, a lot of opioid medications. This does prevent the learner from remembering the things that they need to remember when they go home. So when I teach patients how to do this, I really, really find it important to give something to them to bring home so they don't forget. I try and get the patients in before they take medication, or we tell them not to take medication before coming in. They can take it, right when they leave or whatever. That way that isn't, something that's going to impede in the learning process. I think that psychomotor learning objectives are important because it forces the patient to actually use their hands and take control of their health. So I think that is really well received by a lot of patients. Even if they don't feel confident when you're there and you're helping them, it tends to work out well with them remembering because they're actually doing it. And they're not just listening. Sometimes patients can zone out or they get anxiety and they're not thinking about something. And when they're actually using their hands and their cognitive skills at the same time, they're really engaging. So they don't have as much time to, their minds to wander. Let's see. So the material, they had the material. I thought that worked out good. They can take that home. They have the Stanford Health website, which I also cited on my teaching plan that has not only the instructional pamphlets for the glucometers, but it has when to call your doctor, outside resources, if a patient needs help getting medications or glucometers or anything like that. They have all of that on their website. So it's a really, really useful resource. And then as far as what have I done right, I made sure the patient was able to complete the task required for their learning objective instead of just telling them something and hoping that they know it. So I know for a fact the patient can take control of their health and play an active role in their health care. I made sure that their learning accommodations were addressed if they had any. I made sure that the patient understood the objective by having them demonstrate their knowledge. And as far as what worked well, being able to have a somewhat simple device on hand to show the patient what needed to be done to accomplish the goals is very, very important because the patient can see it, they can feel it, they can use it. That is really helpful when teaching patients new things. As far as improvements, I could definitely use better teaching material, and unfortunately our facility doesn't have a lot that they give us. So what I found was through our student research for this project, I would love better teaching material. I know Baycare has a lot of great stuff, but I couldn't get my hands on it. And then another thing that I maybe could have addressed was more language availability. So I have, we have like Spanish and French and one other, maybe Chinese or something, diabetes care information at our facility. And then we also have access to interpreters, but it's quite difficult. So more language availability is definitely something that could be an improvement in what I presented. So yeah, and that's it, I think. All right, thank you.